Good evening. This is Dr. Alvin Jeffrey Cowens. Also, as you can tell, I'm wearing my FAU shirt. I am a former athlete for Florida Atlantic University. Played college basketball for 4 years from 2000 to 2004. And after that, I went to Barry University in Miami to get a master's in biomedical science. And after that, transitioned to podiatry medical school at Barry University in Miami and did a 3-year residency at Mercy Hospital in rear foot and ankle surgery. And I just wanted to give a message to those inspired to be athletes, inspiring to be college athletes and professional athletes, and who are currently amateur athletes. This message to those who are already suffering from chronic pain and injury to the Achilles area and the foot. So this is a little message for you guys. The message is if you're dealing with chronic pain to the back of the Achilles area, take it seriously. I read a recent study in the sports medicine, the American Journal of Sports Medicine, and they did a study on performance outcomes in NBA players with Achilles tendon injuries, and they did a retrospective study on 18 professional athletes that had a torn Achilles tendon that needed surgical repair. And the study found out that of those who had to get surgical repair, 40% of those athletes never returned to their sport. Those that did return to their sport, 11 only played for 1 year, and then the rest, the 8 remaining players that were able to recover from surgery returned and played for 2 years. So this message is for those athletes having those problems in the Achilles area. Take it seriously. Some things that you want to do if you're already suffering from pain in the back of the Achilles tendon area, the back of the foot, is one of the most important things is stretching. You want to stretch your Achilles tendon before practice, after practice, when you wake up in the morning, and when you go to sleep at night. And some ways that you don't want to stretch, that don't get the effective stretch, is standing up, putting your hands on the wall, and trying to put your foot backwards to stretch the Achilles tendon. Not the best method. Or laying on the ground with your hands up and you're trying to place your heel behind you on the ground to stretch that Achilles tendon area. Not the most effective method. Another method is standing up, trying to put your foot on the doorstep or on the wall, trying to bring your toes back that way to stretch the Achilles tendon and the calf muscle. Not the most effective method. The most effective method is using a rope, a towel, or even a belt, lying down or even sitting straight up with your feet extended. You want to wrap the towel, belt, or rope around the balls of your feet, and you want to actively stretch that Achilles tendon while you're seated by pulling, maybe holding it for 1 or 2 seconds, and then relaxing. This is one of the most effective ways in stretching the Achilles tendon. This is more of an active stretch, and another reason is when you're standing, trying to stretch with the wall, or you're on all fours trying to place your heel behind you, or placing your heel up against the wall or a stair or so. The reason that's not the most effective method is because you're standing upright and your muscles are constantly firing to keep you standing. If, let's say, we were able to turn off the muscles just like we turn off a light switch, turn it off while you're standing, you would completely fall to the ground. So if your muscles are contracting to keep you upright, you can't get a full, thorough stretch of the Achilles tendon and of the calf muscle. So you must be fully seated or laying down or sitting upright with your feet extended, resting to get that more full, thorough stretch. Aromatis method of stretching. If you ever go to an NBA game, you don't see players standing up against the goalposts, leaning up against the score table, sitting on a chair, trying to manually stretch their Achilles tendon. They're out in the center court and they're using ropes to stretch their Achilles tendon, or they have the trainer out there applying pressure to the toe areas, dorsiflexing the foot back, trying to stretch the Achilles tendon. So that's important, very important. Number two, you want to do something called eccentric strengthening. That's very important for the Achilles tendon. And eccentric strengthening is you know how when you're standing and you want to do toe raises, you're standing on the floor, you go up and come down. It's kind of similar, but it's slightly different. What we want to do, we want to stretch the Achilles tendon while strengthening it and contracting it at the same time. So it's best to get on the edge of a stair. So you can say your edge of a stair, put your hands up on the rail to hold your balance, and you want to slowly go up on your toes and then slowly go back down below the stair area. This strengthens and stretches your Achilles tendon at the same time, which will prevent a lot of chronic tendinosis of the Achilles tendon. The number one reason that people have Achilles tendon ruptures are mostly from chronic degenerative injuries to the back of the heel. And then two, it's you're kind of born with the bad biomechanics where your Achilles tendon inserts at more of an oblique angle or so. And those biomechanics can predispose you to Achilles tendon injuries. And normally, when you have Achilles tendon injury, you either have degenerative issue and that chronic contraction that propels you up or out with a degenerative tendon, or with an oblique tendon can spontaneously rupture the tendon. This is one of the most devastating injuries in all of professional sports. It's one of the strongest tendons in your body, but one of the hardest ones to recover from. The tendon doesn't get very good blood flow, especially 2 to 6 centimeters. We call it the watershed area from where the Achilles attaches to the heel. So with that being said, you must, as an athlete, as a basketball player, football player, you name it, you must treat your Achilles tendon like you treat the rest of your body. Treat it like when you get nice pair of shoes so your feet don't bother you. Let's say you're a baseball player and or a pitcher or so, and you like to strengthen that rotator cuff or so. You must pay the same amount of attention to the Achilles tendon because it is a career it's a career ender, as you can see. Nearly 40% of athletes that rupture their Achilles tendon don't return to sports. For every Terrell Suggs who returned in 6 months, or Kobe Bryant who returned in about nearly a year's time, you have many players, including players like David Beckham, whose Achilles tendon rupture that he had nearly ended his career, and it will end most other athletes' career. So very important. Shoe wear won't change the Achilles tendon issues that you have. Sock wear won't change that. There's nothing really you can do other than lots of therapy. Icing, an effective way to ice is get a styrofoam cup, fill it with water, put it in the freezer, and once it freezes, take it out, tear off the ends, and then massage the back of your Achilles tendon. That will reduce a lot of inflammation that you have there after working out or after a game or after training or so. Baby your Achilles tendon is extremely important. So with that being said, I hope this information helps some of you athletes to let you know that repairing your Achilles tendon is very serious. Last thing, those players that were able to return to their sport in the NBA for those 1 to 2 years didn't return to half their playing potential, did not perform half as well as they did before the injury. So take care of yourself, take care of your body. Your body is your way of getting an education, way of making some money, and way of beginning your future whenever sports ends. So make sure that you use basketball, football as a tool to find out to be able to do whatever you want to do in your life. Just think about the average NBA career now is about 4.5 years in the NBA. let's say 4.5 years, and the average NBA player that plays 4.5 years makes between $500,000 and $1.5 million in their each year for average of 4 years or so. And with taxes and paying agents and housing notes, by the time they retire, most NBA players maybe or lucky have $2 million in their account. And the average retiring age of NBA players is the age of 25 to 26. So 25 to 26 years old, most people are just getting their career started, and you've already retired from the sports. So please have a backup plan. Use basketball or football, baseball as a tool to get your education. If you really want to make some money, when you get your education, focus on the STEM fields, focus on technology, focus on entrepreneurship. Use those tools that you learn in sports, which is teamwork, dedication, hard work, overcoming adversity, will to win. Use those methods to help propel you into a successful career, and let your $2 million that you save from the NBA propel you to higher heights and able to make more money and to help out your community and friends. So with that side note, this is your Dr. Alvin J. Cowens giving some nice advice. And I know you guys have voted, and a lot of people are upset with Trump, that he's the president, and some are pretty happy that Trump won. Well, my advice is, even though Trump and the Republicans or so control the House, the state, the Senate, and also the White House, whether you're Republican or Democrat or not, they don't control your destiny. They don't control your life. You control your destiny. So with that being said, by controlling your destiny, pull your resources together. Pull all your resources together with your friends, your community, participate in what we call cooperative economics, educate, mentor the youth in the community, give health advice to the elderly, to kids, to those who are having medical issues, educate yourself, start businesses with friends and families, plan your future, save, invest, research, and then dream again. And lastly, seek to help others that are in need. Build your community. Doing this, no matter who's in office, none of that will affect your life. You will affect your life. Those who you work with will affect your life. So even though it may be tougher for if Trump is in office or not, doesn't matter. You control your destiny. So this is Dr. Alvin J. Cowens giving you some advice. If you have any questions, you can email me at jeffcfau25@hotmail.com. Again, jeffcfau25@hotmail.com, and email me any questions, and I'll get back to you as soon as possible. Hit the subscribe button below so I can talk to you guys some more. Anyways, good talking to you, and look out for one another. All right, have a good day. Peace. Love y'all. Some more additional advice to make sure that you prevent. Another way to prevent any Achilles tendon issues is, let's say you get a cold or get some type of infection, or you just got the sniffles. Make sure you stay away from all fluoroquinolone antibiotics. Don't take ciprofloxacin. Don't take Levaquin. Stay away from any fluoroquinolone antibiotics, because the studies have shown that this antibiotic predisposes you to tendon ruptures. Stay far from those antibiotics or so. Anti-inflammatory medications are fine with helping to decrease some swelling of the Achilles tendon. Some anti-inflammatory medications that are easier to stomach are like Mobic, Duexis, and even some diclofenac would help to help reduce some swelling in the area. All right. Thank you guys for listening. Talk to you later. Bye.